Hi, everyone, and welcome back to Quitting House series Behind Closed Doors, where we're going to take you to various departments throughout the hospital and introduce you to the different career opportunities that exist in healthcare. On today's episode, we're exploring careers in our pharmacy. Let's go take a peek.
The pharmacy team supports the overall hospital with pharmacists and technicians. So the pharmacists look after all the clinical aspect of hospital with doing therapeutic checking, antimicrobial stewardship. They're entering orders currently, verifying those orders with the physicians if they need to, as well as looking at blood work and renal function and anything that is clinically appropriate for that role. The pharmacy technicians look after the hospital through drug distribution and making sure that the right drugs are available for the right patient at the appropriate time.
So a typical day as a pharmacy technician in a hospital setting is many different jobs that you can be coming in to do. Usually, if you're assigned as a picker or a runner, is what we call it, you would come in and you would, in the morning, there would be a restock, and you would pick the drugs that are needed for each floor of the hospital. And then we would then run it up on the carts and load all the Omnicells, which is a drug dispensing machine, on each floor. So that's a lot of the job. But then there's also something called MedRec. So you complete patient interviews about medications that they're taking at home. And that would be for the pharmacist, so then they can review that. We would also be repackaging medications into unit dose packages. So basically that's like you take a stock bottle and then you put it through a machine and it spits out one drug in each package. And you can receive medications. And there's also compounding. There's non-sterile and sterile compounding. So the process to become a pharmacy technician, it isn't too long, but it's very fast paced. So I went to Fleming College, and it was a 2-year program. And then from there, I did my placement while I was in school. I did retail placement, so community pharmacy, and then I also did a hospital placement. So there's 3 exams that have to be completed. There's what they call the PEBCs. So that's an entrance exam to become a technician, and there's 2 parts to it. There's a multiple choice and a practical. And then there's another exam that's just for the province of Ontario. So if you become a technician and you have to move to another province, you would have to repeat that exam as well.
A typical day here at Quitting Health for any pharmacist would be working on your assigned floor. For myself, I work predominantly here in the ICU, and our morning starts off with our sit-down rounds with our interprofessional team. So this involves the ICU physician, respiratory therapist, physiotherapist, myself, social worker, and our charge nurse and unit clerk. Here we go through each patient individually, one by one, and establish any major changes that may have experienced overnight or any new pertinent consults or concerns that involves the patient. We establish a plan for each patient individually. After our morning rounds are finished, then we start carrying out some of those consults, so whether it's therapeutic drug monitoring, renal dose adjusting, changing antibiotics for antimicrobial stewardship, and then just sort of typical monitoring for medications that patients are on here in the ICU. Those are a lot of the consults which take up most of your day. And as the day goes by, there could be new issues. So a blood culture result comes up, or a new medication comes up, and the patient loses their IV access. So converting something to oral as well too. And patients, sometimes they're not currently on a ventilator, but then they're required to go on ventilation, and then adjusting their medications because not all medications can be administered through feeding tubes. So those are some of the typical consults we see here in the ICU. Yeah, so some of the differences. So here in a hospital compared to community, so we physically don't really touch medications. In community pharmacy, you will put more hands-on with checking those medications. So here as pharmacists, we don't really touch medications. The medication distribution process is mostly performed by pharmacy technicians, and we have automated dispensing cabinets called Omnicells, and nurses have access to those. They're very secure, and they pull patient-specific medications out. So I think the actual physical contact with medications might be something that's surprising. And also another big thing, which we do a lot more here in hospital versus community pharmacy, is some of our collaboration with physicians. a very high number of infections that are treated in the hospital. There's a high number of high amount that are pharmacist managed. So physicians will just come to you and say, hey, the patient's blood culture is growing this. What should I put them on? Versus in the community pharmacy, you may not have that laboratory information or the details about the patient case, and you're maybe just be dispensing what's in front of you based on what you know. But here, our involvement from the start to finish, establishing durations, if it should be IV or oral, those are all questions that physicians would ask pharmacists, and we'd be following those patients throughout. So those are some of the big differences you might experience between hospital and community pharmacy. So initially, you need to do 2 years of undergraduate studies at least. Most patients in the program at the time I did it did have 4 years, but you can, if you complete the requisite courses in 2 years. Mostly involves chemistry, biology, calculus, the math courses. Once you're accepted into pharmacy school, a traditional program would be 4 years. However, just recently, U of T announced they're having a 3-year program, but there's no summer breaks. And once you're in pharmacy school, every summer there's placements to do. So you'll be assigned different placements, whether it's industry, community, hospital, research. So there's very different amounts of placements that you have to do. And in the traditional 4-year program, the last year is completely on clinical rotations. So you spend the whole year traveling to different places and spending about 6 to 8 weeks at different locations to have rotations there. And at the end of it, you become a pharmacist. And then there's a licensing exam to write as well too.
So the things that they wouldn't know is that the amount of staff that we have, it is always a surprise that at any given day, there's about 40 staff members between pharmacists and technicians. The pharmacists have a smaller group, and there's probably about 12 to 14 on a daily basis. They look after all of the units, so any patients that is admitted. And the technicians, there's about 27 in a day, and that covers all 4 hospitals. So that is a big misconception. The other thing is that we prepackage all of the medication into unit dose. And so what happens with that is that's all manually done. And a lot of staff or a lot of people would not know that our technicians do all of that prepacking. Our packaging machine packages over 1 million doses in a year, and that's what gets put on the Omnicells.
So hopefully you learned something new today about opportunities in the pharmacy field here at Quinte Health and beyond. If you'd like more information, check out quintehealth.ca and click on Career and Education Opportunities.